This is Fox 5 News at 10. Local Las Vegas.
A deep suntan used to be considered a sign of beauty and good health, but doctors say that bronze glow is really just damaged skin.
Tanning can lead to premature aging and skin cancer. Still, many people can't resist the tanning bed or lounge chair. Tonight, the growing problem of tanning addiction. The need for a tan outweighing the risk of a life-threatening melanoma. For many, nothing comes close to a day of fun in the sun. But baking to a nice shade of golden brown has consequences you might not notice until the damage is done.
I love the sun. It's the only place I relax.
45-year-old Christine Arnone spent her youth soaking in rays, never worrying about sunscreen. One day, that all changed.
Was getting ready for bed, and my husband said, "Your doctor's on the phone," and I said, "What doctor?" And I knew exactly who it was.
Christine's doctor, an affiliate of Las Vegas Skin and Cancer Clinics, told her she had melanoma, a deadly, fast-spreading skin cancer. Her dermatologist caught it in time, but Christine still has to fight the urge to tan.
It's hard. I still want to go lay out in the sun, and I can't.
You're not feeling so hot when you're really pasty.
27-year-old Gina Reyes is a bartender and cocktail waitress. She's heard the horror stories, but still uses a tanning bed to look her best.
Definitely when you go out to the nightclubs, you see a lot more flush and a lot more tan bodies, so I think that has a big impact on it also.
When people get tanned, they feel good about themselves.
Cosmetic dermatologist Dr. Jason Michaels removes anywhere from 10 to 15 skin cancers a day at Aspire Cosmetic MedCenter. He explains why it's so easy to become addicted to the sun.
So there's a lot of self-confidence to that. They feel a lot more approachable. They have a higher self-esteem. So there's the addiction partly to that.
Dr. Michaels says it's emotional and physical. The body releases endorphins when people tan, which make them feel good.
It's very, very relaxing. When you're just laying there in the sun, it's just no worries.
Gina is going to see Dr. Michaels. She knows the ultraviolet light will eventually catch up to her. She wants damage control, tanorexic or not. Christine hopes other sunbathers will do the same.
I enjoy the sun, and I know a lot of people do, but it's not worth it. It's not. You hear it, but you just don't think it's ever going to happen to you.
Dr. Michaels echoes that sentiment. He says there will be 1 million new cases of skin cancer diagnosed this year alone.
What do you want? The tan, or do you want your life? It's your choice.
Dr. Michaels says people who have spent a lot of time in tanning beds before the age of 35 have a 75% chance of developing melanoma at some point in their lives.
So what do you do if you've grown up in a place like Las Vegas and now you're noticing the sun damage?
That's what a lot of people are worried about. Dr. Michaels says there are several treatment options for wrinkles and brown spots on the skin, blood vessels. We'll tell you all about those coming up at 10:35. Then the damage is done, but how can you reverse the effects of the sun? It's not cheap or painless, but it can be done. We'll show you. It feels good, makes you look good, but years of sun exposure are starting to catch up to you. So what now? Well, the first thing you should do is go to a dermatologist to check for skin cancer. Then it might be time to talk about sun damage treatments. One of the most popular is a different type of light that zaps away the lines and spots clouding your complexion.
It's ironic in that we want to look good by getting sun exposure, but it ages us a lot quicker, and ultimately we look a lot worse.
95% of the people Dr. Jason Michaels treats at Aspire Cosmetic MedCenter are trying to regain the youthful look the sun has slowly simmered away.
The thing that I noticed the most on her is, again, this idea of solar damage.
In Tracy's case, brown spots and a dull complexion brought on by years of tanning. Spotty skin is common in the desert, so Dr. Michaels uses light-based technology to undo what nature has done.
We're going to actually do several things on her to restore some of the glow to her skin, but at this junction we're going to actually try and treat some of the individual brown spots that she has by creating more of a symmetry of her skin by treating the entire face.
Dr. Michaels starts with a cooling gel to help properly dispense the light. From there, he administers the laser treatment, one brown spot at a time. It looks painful, but...
And the way people describe it is like a rubber band pop.
The results are seen within a week. The treated areas peel off like tiny cornflakes, revealing the healthy skin underneath. But Tracy has to take it from there.
We don't want the sun to stimulate the brown cells to get darker, and so she's got to practice incredible sun avoidance and sunscreen.
Next, a micro laser peel to restore the skin's glow by removing superficial layers of the skin. A different laser is used in this treatment. Dr. Michaels says using just one laser will not achieve optimal results. There are multiple lasers and light sources for different procedures and skin pigmentation.
There's a few days of where you'll be pink. You almost feel like you have a little sunburn.
The micro laser peel causes little peeling, and most people can go back to work the next day. Here are some before and after photos once the skin is returned to normal. But Dr. Michaels reminds us none of this would be necessary if people would limit sun exposure and wear sunscreen.
And if you get color on your skin, if you have any type of tanning to the skin, tan skin is damaged skin, period.
So now what's the damage to your wallet? The lasers to treat the brown spots will run anywhere from $200 to $750. The micro laser peel that's used over the whole face is around $1,200. And remember, Dr. Michaels says different lasers do different things to the skin, so it's best to see a trained physician, a dermatologist, for these procedures.